All right, awesome. Welcome to the National African American Child and Family Research Center's Research Capacity Building webinar. I'm honored to serve as the director of the center here at Morehouse School of Medicine. Just want to give you all a couple of reminders before we get started today. We are recording this session and we will have the recordings available on our website as well as on our YouTube site. Please feel free to use the chat for any comments or suggestions or resources that you want to share. And you can also use the Q&A box on the menu to ask any questions throughout the presentation. We'll stop at the end of the overall, after everybody's presented, to answer any questions that you all have. This time is going to go by quick. There's a lot of great information that's going to be shared. So just be present with us in this moment and participate in the discussion. So today's webinar, or this month's webinar, is focused on community engagement approaches. And we have some great leaders and experts to share with us about the ways in which they've been able to engage Black and African American communities in research. And so I'm going to stop sharing and introduce our first speaker, who is the soon-to-be Dr. Gina Green Harris. She is the inaugural director of the award-winning Center for Community Engagement and Health Partnerships at the regional office in Milwaukee. Through this center, she also serves as the director of the Wisconsin Alzheimer's Institute. She's a champion of health equity and helped to guide the center to further advance research in the African American community in a culturally inclusive manner. She's participated in many research programs, received many awards. She's been appointed to several university and community committees, including serving on the technical work group for the National African American Child and Family Research Center. She also currently serves as the chair of the State of Wisconsin Governor's Health Equity Council and the National Institutes for Health Community Engagement, Recruitment, and Retention of Underrepresented Groups Steering Committee. So please let us turn our attention to Ms. Green Harris. You have the floor.
All right. Good afternoon, everyone. You guys can still hear me all right? I took off my headphones because they were bothering my ears, and we're going to go with it. Yes. So it's my pleasure to be here. I'm going to share my screen and get going here so we can talk briefly. So again, I want to thank Dr. Rollins for inviting me to this conversation today. And I am excited to be here. I'm going to talk briefly about our methods of using asset-based community engaged research to do our work. And I'm really trying to get this into PowerPoint mode, and I'm trying to get there. Hang on one second. Slideshow from beginning. There we go. Much better. So I'm going to be talking about using asset-based community engagement to build partnerships and to enhance research participation. Dr. Rollins gave a great overview of who I am. We can move past that and talk briefly about our programs that we do here at UW. So the Wisconsin Alzheimer's Institute, I'll talk more about the Center for Community Engagement Health Partnerships in a little bit, but I wanted to start off by talking about the Wisconsin Alzheimer's Institute. And basically, we are a regional Milwaukee office that ignited community engagement into research as we were thinking about recruitment strategies for underrepresented, underserved, and quite frankly, under groups that seldom get the best opportunities for research, meaning we focus on African Americans in particular. And we have 5 integrated pillars in our work. We've moved from community outreach. We started with community outreach to now community engagement, professional education, advocacy, service, and research. I won't talk about all of those categories today in detail. I will focus mostly on our community engagement model. And we believe that our model empowers the Milwaukee, southeastern Wisconsin areas, and again, primarily African Americans, because we certainly do this work with culturally specific healthcare for our aging population and those affected specifically through this group, Alzheimer's and dementia. But when we talk about the Center for Community Engagement, we talk about across the health spectrum as a whole. And so what are our founding principles and guiding principles? We really think about our work inside of the establishment of the Belmont Report, where there was the discussion of, most of you will know or recall, the Belmont Report really got its legs and it's got its start when we were thinking about the issue surrounding Tuskegee and how that horrific situation occurred. And we talked about good science, good ethics. But if we further advance the work of the Belmont Report, we can think about later on, we talk about work that was specific to the HIV/AIDS momentum. And that's where we talked about more community-based participatory research. We talked about community support in clinical trials as we were thinking about how are we going to find ways to address the effects of the HIV epidemic. But when I and our team were really looking for foundation, we knew that these three principles would guide the work that we do around beneficence and principles of justice, and then respect for persons. And when we were looking for respect for persons, as we were thinking and looking through the research and through the pretty much the policies that were in place, we recognized that community was not necessarily involved and engaged in a very meaningful way. We understood that, we had the comments, we had the clarity of what the Belmont Report was saying, but what we did not have was the essence and the true voice of community from their actual perspectives. And so that's exactly what we wanted to launch into, using the Belmont Report, but then extending this work into having community voice in the work so that we could have the respect for all communities as we were doing our work. So what do? We thought about this word, what is community? And, in general, we talk about community as a defined geographic political area, right? That population with the same characteristics, society, it's pretty much, insiders, outsiders, but research institutions were excluded from community. We didn't necessarily agree with all of those defining principles. So what we decided to ask the community was, how do you express community? What is your vision of community? Because where we live, you can have community block by block, person by person, city by city, but it really had to be expressed from the perspective of what the people were saying. And then we started asking the community, because we as investigators use these terms ever so loosely, and we think they're very vivid, and we think they're very common among community, but are they the same? And are we using them in the same context? So is there a difference between a community member and a community stakeholder? And a community member is an actual stakeholder. And so we had to start rethinking how we were using these words contextually. And then we also talked a lot about, what does this term lay community mean? And is it an insultive kind of word, or is it a confirming word? And so we talked to the community, and actually we learned, lay community and community members, they think about lay congregations. They used it with faith often in Black communities. And so for them, it would mean just volunteerism. It meant things that we were using differently in our research context than what was being used in community. So as we define community, we began to work with the community to develop what we know is called our asset-based community development model. And it was our outreach model at first, and we then began to hone it. But the first steps, again, moved us from thinking about outreach, right, where we were reaching out, to actually moving into engagement, where there was this bi-directional, intentional relationships. One, by first identifying the community. Who are the community? Who is? What does that mean, right? And then addressing, what does the community say it needs and wants, and how does it prioritize its needs? Our issue at that time was Alzheimer's dementia. The community's priority was dementia, heart disease, and quite frankly, feeling safe because of the level of violence, right? So then we went from there to talking about As we got the engagement of the community, we began to understand the involvement that it would take and bringing community to the forefront of that involvement. And what we had to do as an institution was step back in order to develop the relationships to become the fabric work with the community, intertwined and interconnected with the community. And we did that by investing in the community. So often we divest, but we had to invest. And by investment, I mean spending time with community, identifying what they need, bringing those resources that were requested, not the resources that we thought we wanted to bring, but really identifying how do we invest time, treasure, talent. Those were three things that we knew we had to do. We had the resources, but we had to move from being content experts into community novices. And that built the relationship. And then providing resources as they were identified, not just for the time of a grant, not just while we were building the relationship, but for sustainable times and for those resources to remain in the community even after our work was done. And then the third part, after that involvement, that drove us to be recognized by community as experts and validate that the community were experts. The community actually had the strength. We talk about this. I talk about this often with my colleagues. Communities have strengths that we do not know. They have to expose us to those strengths. Not everyone in the community that has diabetes is an amputee. Not everyone in the community that lives in our neighborhoods are on, subsidized incomes. Not all of them have poor health outcomes. Not all of them are undereducated or according to the academic standards. So we had to recognize that when we were entering the community, there were expertise that the community actually could offer us than what we had understood. When we began to do that, we began to take off the scabs, and then we got commitment from community as we humbled ourselves and actually started asking relevant questions to the community, not relevant questions to our research. And so this is a quick slide I wanted to share with you about what happens when we do that. When we start asking folks, what motivates you to contribute? How do you think of health equity? We begin to get clear-cut answers. Now, what this slide is real quickly is the question was, how do we address disparity and what do we want to see some of those outcomes surrounded that are associated with disparities as we know, so we can flip the switch and shift the paradigm. And this work was actually done in my capacity as the chair of the Health Equity Council at the Governor's Equity Council. So representation rose to the top. Clearly, the community wants to have representation. And as you see, there's voices and seat at the table. And we wanted to move from injustice to justice, shifting to real change, talking quite frankly, very transparently about those shifting power resources and systems and structures. And naming racism was really important to a community, right? So it gave us what we really needed to know and understand so that we collectively can go back and address these issues in a way that would actually bring about change, that will bring about support and sustainable solutions that would bring about sustainable and long-term, not just solutions, but programs, service delivery models, and thereon. And so we've written a paper about this. We wrote this paper to talk about our model, but to also talk about how we've done this thing called asset-based community development approach. You're welcome to go read it. I won't go over it, but it has been used as a platform for community-based asset development research in several worlds, and particularly in our Alzheimer's work specifically. So we move from this work into thinking through those principles of community engagement. And this is actually in the paper. We all talk about Minkler's work that she has done specifically about these principles, right? Moving all the way from building on the strengths and the resources to those community, all the way around that spectrum to the long-term commitment. I would submit to you that when we think about doing this asset-based model, you have to recognize that they're coming from a strength position versus the deficit of the woe is me. One of the things the community says to us all the time is, we know our problems, we know our circumstances, we need you to help us figure out for solutions that are going to change us. And that's where building on those strengths come from, and empower resource sharing is really important. And by sharing resource power, I'm talking about this bi-directional relationship now, where you are actually not going into the community asking, but actually going to learn and then hear what those needs are from the community, and then shifting that paradigm that they are actually leading and working with you to develop the new ideologies, the new concepts, and the innovative strategies, that you are empowering them, that their voice is more than recommendation, but their voice are change agents. And that's where we go with this entire model. Again, I've got 10 minutes, so I won't go through the whole thing, but I want to emphasize that we go through all of this. But I do want to hop over before I switch slides to this thing called disseminate, finding, and involving all partners. This is where we as investigators and institutions tend to fall off. We will ask community, quite frankly, for their input, their intellectual properties about how do we do this work, who do we need to contact, could you please be our liaisons? But when it comes time for sharing that information out,
Oh no, she was about to give us the best tip around dissemination and it shut her down. Let's let her rejoin. But
Zoom couldn't handle it. It was too powerful. She was about to drop a bomb on him.
she was about to get you. She was about to get you.
It was a mic drop moment.
All right, if she jumps back on, we'll get her at the end, but let's keep moving since we have our folks here and want to be respectful of your time. I'm going to introduce Dr. Liz Miller. She is a professor of pediatrics, public health, and clinical and translational science. She is the co-director of the Community Partners or Community Engagement Core for the Clinical and Translational Science Institute at the University of Pittsburgh School of Medicine. She also co-directs the Pittsburgh study, a landmark collective impact community partner intervention study that seeks to identify and evaluate best practices to support child and adolescent health and thriving. And so as a mixed methods intervention researcher trained in community partner participatory research, she also teaches courses in stakeholder engagement and knowledge translation. So I'm going to turn it over to Dr. Miller to share with us. You can share your slides and take it away.
Do my slides show up okay?
Yes, you're good.
Awesome. Thank you. And apologies to all for Zoom just not cooperating today. But I will take a few minutes just to say what an extraordinary privilege it is for me to be here with all of you and an opportunity to learn together. And I have had the joy of learning with and from Dr. Rollins for the last 3 or so years, and just delighted to be able to share some thoughts around what we have learned through implementing the Pittsburgh study in Pittsburgh, and mostly framing this, picking up on what Gina was sharing with us about assets and community expertise and wisdom, and thinking about how much what it means to really center community voices. Want to spend some time thinking about it from my perspective in terms of what do we need to do to build trustworthiness of science through research practice partnerships, and specifically lifting up this concept of research reciprocity. And very briefly want to position myself. The top photo is my hometown of Japan, bottom photo where I am now in Pittsburgh. And what I have had the opportunity to learn from so many community members is how, as a scientist and as a clinician, I can continue to do the work of repair, the work of centering community wisdom, and actually operationalizing community collaboration in the process of building trustworthiness. And when I moved to Pittsburgh, I have to admit, because I grew up in Japan, did not actually even know where this city was on the map. I have now been there 13 years. I have been part of documenting a really horrific history of segregation and continued perpetuation of structural and systemic racism and inequities that continue to this day. And in 2019, had the opportunity with a report prepared for the mayor's office to compare Pittsburgh to 89 other cities, comparable cities, where we documented really significant differences and where Pittsburgh ranks among the lowest in terms of Black maternal health, infant mortality, the school to prison referrals, disciplinary referrals, in particular for our Black students. And this report really prompted I think ways in which our healthcare delivery system needs to be much, much more involved in changing the systems and structures that perpetuate these inequities. And certainly, none of us will ever forget the spring of 2020, both the start of the COVID-19 pandemic, but also the horrific loss of so many Black lives that were finally documented, including the murder of George Floyd, and prompted, I think, a real shift, I hope, within our education system for health professionals and a commitment to doing better than certainly the really horrific history that we have. And so the Pittsburgh study, though, is not about doom and gloom. It is about recognizing that we have a lot of work to do in terms of building trustworthiness, but also comes with a recognition that during the COVID-19 pandemic, many people were saying, the reason we're not getting COVID-19 resources and vaccines out to our communities experiencing disadvantage is because of all the mistrust. And what we have really been trying to do through the Pittsburgh study is flip that narrative to focus on what are the strategies and what can community members teach us about how we as health professionals and as scientists can build our trustworthiness. And the Pittsburgh study started actually pre-pandemic in 2018 with a commitment, collective impact commitment, so that every child in our region is healthy, thriving, and achieving their academic goals. It is unabashedly focused on thriving and racial equity. And in that context, Dr. Rollins had asked me to talk about, well, how do you structure things where you really want to lift up community wisdom? And the way we do this is all of our scientific committees have community leaders and professional scientists working shoulder to shoulder, with every scientific committee having greater than 50% community representation. And in fact, we even problematized this concept of thriving, recognizing that thriving across our different and diverse communities may have really distinct meanings. And on the left there is Val Chavis, who was the co-founder of the Pittsburgh study with me, now works as the community engagement coordinator at the University of Pittsburgh in the Department of Psychology. And to my right, Felicia Savage-Friedman, who is currently our co-director of the Pittsburgh study, an integrated anti-racist yoga instructor, and most recently and very exciting in February of 2024, became the first community member without an MD or PhD degree to become faculty within the School of Medicine. And she actually is the course director for our Racism in Medicine course. And it is this small sort of group. We actually have a core team and our scientific committee leadership across multiple developmental cohorts, from pregnancy all the way into adolescence, as well as a scientific committee focused on data accessibility and dissemination, another committee focused on environmental justice, another committee focused on neighborhood level transformation, all with those community assets that Gina was talking about earlier. We have shared principles, number 4 being a vitally important one, which is developing research with people and not on people. And we continue to come back to these shared principles regularly to evaluate how well we are doing in terms of centering community expertise and wisdom. As noted, our Child Thriving framework, we did a very extensive community listening, mapping, and concept mapping process, arriving at this way of thinking about child thriving across multiple domains, including fun and happiness, vibrant communities, healthy environments, but making sure that we are always thinking about measurement of thriving and not just surviving, and certainly not solely the deficit-focused approaches that unfortunately many of us in professional sciences engage in. And so while I don't have much time to dig into the specifics of the Pittsburgh study, to say that we are evaluating community co-created, positive, so thriving-focused health interventions. We are also following children and families long-term, and as I noted, engaging in a lot of cross-cutting scientific committees, including some work with community members on data literacy, making the use of data, understanding data, communicating about data even more accessible, usable for community members. And so I will conclude with sharing a thought from Felicia Savage-Friedman, our co-director. She writes, "We strive for collective impact through continuous learning and collaboration. Undoing systemic racism means practicing together over and over, having vulnerable conversations in relationships with researchers and community members. We reflect and share as individuals how we've been impacted by racism, marginalization, and discrimination. Please join our community." And it is certainly in that spirit that I wanted to share just a few hopeful thoughts about one of the ways in which we are trying to build trustworthiness in science through promoting research reciprocity. So thank you.
Well, that was quick. So we are going to have Ms. Green Harris come back and just pick up where she left off, talking about the principles of community engagement and dissemination, particularly as one of those principles.
Sorry about that, guys. I work in a hospital, so you have to forgive us when they don't allow us. Sometimes they drop us, so I apologize for that. Let me get back to my slides. I believe this is the slide that I was on. And I wanted to just, and I think I was sharing as we drop about these principles of engagement where we kind of flex and stop. And specifically, it gets to the point where we're talking about dissemination. And you guys can hear me okay, right? We're good? Thumbs up? Yep.
Yes.
Yes. So this dissemination part, right? We typically will include the community's voice. We will include what we got from the community, but we will not usually use them as acknowledgments. We will not necessarily make sure that that intellectual property is actually supported in our findings in a way where the community voice is very reflective, and or what we actually utilize as recommendations from communities. So we really need to do a better job of doing that. And then also that long-term commitment from communities. When we build a program, research, or whatever the case may be, it is important that we start off with the end in mind. It is so critical that we start asking community members, what would you like to see at the conclusion of this research? You may not find something specific to the initiative, but there are other things that can actually build on the sustainability of the community, such as scholarships, such as relationships with the institution in a very authentic way. So those are things I want to focus on. And then let me go to the next slide. As we talked about the two approaches to community engagement, what are those? Many of us think we're doing community engaged research by just having these conversations with community, but we're talking about bi-directional. And here I want to emphasize community-based participatory research is where you start with the concept with the community follow and walk through bidirectionally with the community from start to finish, and we follow it from beginning to end, voice to voice. We do the research, there's teaching, there's service, there's full engagement, and there's that pendulum of circular relationship back and forth where what the community is saying is actually included into that grant or that research subject. And then here I'll just briefly say, one of the things that I talk about a lot is that we get these first three things, as I said in that continuum of those 8 principles of engagement. Here is where I think we need to really focus our efforts if we're talking about this increased level. We get them involved, we consult and outreach, but we do a shoddy job of collaborating authentically with bidirectionalism. We will say to the community, we will have these CAB meetings, we will have TAB meetings, we will have all kinds of, we call them action networks, we call them all of those things. But the question I ask is, are we collaborating to get to the end goal for us? Because we can always talk about what they're giving us. The question is reciprocity. And we can only do that through true collaboration and shared leadership, meaning you've got to have this voice and shared decision-making processes with the community at the community level, where it actually, if you do a study and the community says, hey, we're not ready for that to be shared publicly. As an investigator, as a program, you've got to be ready as a researcher to say, we'll wait, we'll follow your lead. That's shared leadership. And so I'm concluding now. And what I wanted to share with you guys, people always say, well, why? And why do you emphasize this? Why is asset-based so important? Because the attitudes of the institutions, quite frankly, I started with talking about beneficence and justice and engagement of community. But when you look at what are on the minds of our researchers in 2024, we did this study, in 2023, we did this study with our own investigators at UW and asked, how important is it that we have people of diverse and racial ethnic backgrounds participate in research? 88% or 87% say, yes, it is. But how important is it in your background? You see the dramatic drop in numbers. This is a telltale sign that it is so important that we continue to push this information and quite frankly, the effects of having asset-based community involvement in research, because right now, investigators aren't necessarily getting the understanding of how and why this is going to contribute to good science. And so I leave you with this. These are my principles from practice, from promise to practice. And here's the things I always say we need to do as investigators, because we've got a call to action for asset-based as well. Have a personal mission vision. What is your work? What is your personal why? It can't be about why you need a new grant. Can't be about this next stage of your career, but what's your personal why? Make sure that you're leading your study team, your program has measurable organizational goals beyond a checklist. You need to make sure you're engaging with communities of interest before you have an ask. That's called genuineness and integrity. And then authenticity. Trust the process of authenticity. Be willing to be vulnerable with communities, owning what you don't know, accepting what you do know, and turning it into assets for community purposes. Lead with transparency and longevity. Don't overpromise. Do not underdeliver. And have longevity of commitment to that community. As I said before, developing that bidirectional partnership with community stakeholders and participants, being open, learning, building. Trust versus trustworthiness. Trust is something that we use. I do want to highlight this. We use this term that it shifts the blame of why research engagement is on the community. That's not the problem. Most times it's part of it, but not the sole problem. I shift to trustworthiness. Consuelo Wilkins does a whole lot of work around this. And what that says is, as institutions, as researchers, are we trustworthy? What does our internal structures look like? What do we think internally, and how we treat research when it comes to community? Do we look at the community as our partners in science, or do we look at them as roadmaps and access to what we need to do to get the job done? So we've got got to be trustworthy for the community to come and embrace us. And finally, making a conscious decision to be committed to sustainability. What is your legacy into this community that you want to do research? And after 5-10 years of doing research, are you making sure that you're leaving the community better than when you started and leaving something that will be lasting for them to improve their own health and health equity? And this is it. When I love this quote, my former mentor who has gone to glory used to say this at the end of every presentation. So in her honor, when the best leaders' work is done, the people will say we did it ourselves. And so I thank you. I'm going to end here. I'm not going to share information about our work specifically, but if you want to look on our website, these are programs that we have committed to doing this work with. So thank you for your time. And I do apologize for dropping off before.
Well, that was great. That was great. Thank you so much for sharing with us, Dr. Miller and Ms. Green Harris. We're going to turn now to Sunjata Aya, who is a research associate at MEF, and his professional research interests include improving family and health outcomes for disadvantaged communities, reducing disparities, and promoting equity. His projects now include supporting healthy fatherhood, children and families. He provides technical assistance. He engages academic and community experts to inform research, and is also skilled in community-based participatory research. So I want to turn it over to Sunjata to talk to us about his work, particularly with fathers. And you're on mute.
Greetings, everyone. Once again, my name is Sunjata Aya. I have the pleasure of presenting on the Reframe Project. Can you all see my presentation?
Yes, you're good.
All right, great. So once again, I'm presenting on the Reframe Project, and Reframe stands for Race Equity for Fatherhood, Relationship, and Marriage Programs to empower Black families. And this project, started a couple of years ago, and we'll kind of zip through the presentation outline. I'm going to share with you, introduce my team, the folks who have been working on this project for the past couple of years. An excellent team of folks who have done a lot of work internally and externally to make sure that Black voices are truly elevated. And, thank you also to Dr. Rollins, who introduced me to this gentleman here, who many of you may know as Dr. Bright Sarfo. Dr. Sarfo is the one who hired me at MEF. And he's the original co-principal investigator and project director on Reframe. And unfortunately, he passed away last April. But he's a very well-respected voice in fatherhood, and he illuminated the way in so many different ways. He brought his passion and empathy to the work. It was always visible. And he regularly brought his own experience as a father into how he talked about the issues related to fatherhood. And he brought that same passion and expertise to Reframe. And it was instrumental in setting the format for how we would approach the research and the strategy to center Black voices in programs that serve families. And our strengths-based approach was also something that he was very much integral in making sure was a part of the project. So one of his last acts to elevate of those with lived experience in this work and fatherhood and family was to hire me with MEF and Associates. And my goal is to honor his work and my work. So many of you may know Dr. Sarfo. So I am a father. It's one of my most proud accomplishments I'm the most proud of. And I also graduated from Morehouse School of Medicine. Shout out to Morehouse School of Medicine. And I also am a graduate from HMRF. I see you, Dr. Mayberry. I'm a graduate from the Fathers Incorporated program, which is an HMRF funded program. So I'm a researcher, and I have lived experience as a participant that I bring to the field, and I bring my voice as a father to the table when I, do HMRF work. But I also bring the voices of these gentlemen and many that I've come across over the years in this work. So this is a picture of the Fathers Incorporated graduation that I attended. Historically, the voices of Black individuals and Black fathers specifically are most often not elevated adequately in research. Decisions are made about Black fathers without Black fathers really being at the table. And This is an example of how research is done typically with a lot of research focused on Black families, and thus the reason why Reframe exists. So because Black people are not a monolithic group, and there's a great deal we have to learn from elevating Black voices, experiences like this for researchers are rare but necessary. So for example, from my own experience, although I have my lived experience as a father, a Black father, one of the benefits in participating in this program is that I was able to open myself to learn more about the experiences of other Black fathers and families. And I experienced those voices in a multitude of ways and expressions. And I was moved by them, and I'm committed to elevating these voices in spaces like this, especially because when we honor these voices, we can bring much needed change to this space and actually get policies and programs that are equitable, that are humane. So this is why the Reframe Project exists. It seeks to elevate and honor those with lived experiences to help HMRF programs better understand how to serve fathers like this. And so the Reframe Project, what is it, right? It uses an equity lens to accomplish these two basic goals. Goal one is to elevate and understand the assets, needs, and experiences of Black families. Goal two is to get better program resources for HMRF grant recipients. So HMRF, once again, is Healthy Marriage and Responsible Fatherhood funded programs. And the goal of these programs, as stated, is to strengthen families, promote responsible parenting, and improve economic stability. And the fact is that there's a disproportionate number of Black fathers and Black families represented in these programs. And in order for these programs to really do what they need to do and consistently provide families with compassionate solutions-based spaces, and to ensure that their services are in fact equitable and reflective of the needs of Black families, they're going to need the research, and they're going to need the support to make sure that they're able to prioritize that. They're going to need the skills. And this is a part of how we get this, by doing work like the Reframe Project and some of the other projects that were discussed. So ACF right now is making equity a priority in its mission. So it's a great time for organizations to elevate their voices and to be heard. A lot of times organizations, practitioners are very much trying to fulfill the requirements of an RFP or fit into a box to make sure that they're funded so they can keep their programs alive. But now is the time for that authenticity and their lived experience to really step forward. There is some support on the other side. And I'm here to say that being on this side, it's important that we all do our part to make sure our voices are elevated. So speak up and make sure that those programs have the opportunity to have their voices heard. So in terms of Reframe, though, the overall goal is to help HMR funded programs get better at being more culturally responsive and supporting Black families. So we elevated the voices of three different ways. Essentially, we partnered with an expert work group, community group listening sessions were held, and healthy marriage and responsible fatherhood programs were engaged in focus groups. And then what we did was we had data walks that actually reported back to each of those partners to make sure that we got the message right, that we heard it correctly, and that we're analyzing it correctly and we're retelling it correctly. So that was very important. I'm gonna just kind of briefly describe those three groups. So the EWG, or expert work group, was a diverse group of researchers, practitioners, and Black community members with lived expertise. Some HMR grant recipients, academics focused on Black fathers and Black family. Some of them participants in HMR programming in the past, like myself, and those roles were rotated periodically. Their goal was to hold the study team accountable to equity principles, provide feedback on project approaches and materials, and they helped to check assumptions and biases that may have influenced the project's work. So they played an integral role in making sure that the project was equitable and lived up to the equitable principles. They made sure we authentically centered lived experiences and assessed the data properly, and our interpretation of findings, that they were utilizing a strength-based frame and elevated participant perspectives that wouldn't normally be elevated. So they informed the project practice, research, and programming. The next group is healthy marriage and responsible fatherhood focus groups. Who they were that we interviewed were basically clients and leadership. So we engaged with them to learn more about how HMRF program offerings for Black clients worked. And we utilized the equity principles and engagement approaches with them, a strengths-based approach once again, and we shared study findings back with them in order to really understand whether we got it right. Same thing with the community group listening sessions. This group was basically community-based organization staff and clients. And similarly to the HMRF focus groups, we use them to learn about how community-based programs serve Black clients, to make sure that if any strengths in how these programs function, we could report back and improve the work that's being done and elevate them for the good work that they're doing, but also understand more how these programs are being affected by how research is done, right? So we also use equity principles with them as well, strengths-based approach, and share back the findings. So in terms of applying equitable evaluation principles, this is one of the key pieces. We were applying equitable evaluation principles that support and encourage researchers to effectively prioritize elevating the Black voices and the voices of participants with lived experiences, using a strength-based approach and reporting back to them. It also informed how the research team prepared itself to check bias, power differentials, and cultural propriety. And so in order to check those things, we had external activities that I mentioned before and internal activities. And this is one of the really important pieces that I think makes this project so special. The external work that we did what's called a power web exercise, which was used to check power between involved parties. We then did a perspective microscope exercise through which questions of interest from different focal groups were elevated. So that's how we got to where voices that aren't typically heard were able to be elevated, right? So the internal work, right? We did some self-identity mapping in the research team to understand the bias that we bring to the research and perspectives that we bring to the research, to take account of those things, which I think is something that is rarely done in research that needs to be done more. Not just assuming that because you're Black or because you have certain experience in research that you are equitable, but actually going through a process as a team to collectively account for what you represent, the perspectives that you represent and that you bring into the research. And we also did cultural competency self-assessments. And so that allowed us to understand how culturally responsive we were being and allowed us to check ourselves in the work. And that I think is a major part of how we have been able to get such great feedback and get great findings that we'll be presenting in the near future, findings and recommendations. But this graph right here or this image right here shows how research is typically done, where on Black families in particular, where stressors are typically what we look at first, or what researchers have looked at first when it comes to Black families, and how our research was informed by the expert work group, the HMRF group, and the community group listening sessions, was that we began to look at resilience first. What does it mean to bounce back from adversity, right? And so we essentially collected data in a way that was more respectful to Black participants by starting with the focus on assets, strengths, and resilience versus the deficit and the stressors. We looked at the outcome of resilience and then the process of resilience separately. And what we learned from this was that resilience is not a uniformly positive construct, like it may be assumed to be, because in reference to Black families, the responsibility for change solely lies on Black individuals and families versus changing the systems that are racist or oppressive. So instead of, what we were doing essentially was putting the burden and negative impact of having to be resilient on those who have to navigate systemic oppression. So we learned that and understood from that Black resilience should not be defined by and in service of systemic oppression, but by those who are having to be resilient. So that's a major finding. And this illustration kind of illuminates how different perspectives engaged intentionally can give us a better understanding of areas where there may be divergence in understanding a concept like resilience, for example. So this is an example of an excerpt from the Cultural Diversity and Competency Self-Assessment. And I just kind of put this here so you can kind of see one of the questions. So I'll start with this one. At all stages of evaluation, I examined the potential impact of cultural stereotypes and my own personal biases around race, ethnicity, gender, socioeconomic status, and other individual differences, right? So we had to answer these questions as a research group internally and have a discussion amongst ourselves to really take account of where we land. But this is one of the key pieces that I think also helped us to get where we needed to go, right? We did what's called a Power Web exercise. And this Power Web exercise, we conducted it with the expert work group in the early stages of the project to discuss existing power dynamics between partners. And the goal of the exercise was to promote transparency about those power dynamics between funding, data, and influence, but also to identify ways of rebalancing power and promoting inclusivity in the project so we could share power appropriately. So it started off with the Reframe team. We took that to ACF, the funder, and then we brought it to our expert work group. And the dotted lines that you see here represent the contributions of the expert work group, the cumulative changes. So the influence of the expert work group is felt here and how we rebalance power. And one of the things we were able to do was to identify how to separate this area where it says Black fathers, mothers, couples, youth, and individuals. Using this Power Web exercise, it helped us to build a better protocol to ask better questions from each of these subgroups. So it was a part of how we got to not treating Black families as a monolithic group. And we were able to ask specific questions of fathers, mothers, youth, couples, and elevate the voices, for example, of a single Black father whose voices are typically not elevated. So it also helped us to alter the flow of influence where collectively we began to push back influence to OFA about how racism influences policies. So we have a public facing report as one of the products for this project that will illuminate how some of these policies, affect Black families and how they are in fact racist. So this piece was a very important part of the research. So lessons learned, we sought out diverse viewpoints to increase equity and understand program needs. We prioritize a strength-based frame in our discussion questions and data interpretation. We examine and address power dynamics and iteratively reflecting on assumptions and biases that existed among researchers on the team. And next steps, we're going to publish that public-facing report. We also have products to create that will help to really change how the work is being done, like a race equity framework. We're developing practice resources, all of which that will be, published in the future. So in closing, by elevating the lived expertise and voices of Black individuals and families, we can create needed change in HMRF programming and in our society. So for example, in the case of Black fathers, the propagandized image of the deadbeat dad who needs to be taught how to be responsible can be replaced with the multitude of inspiring historical and current accounts of Black fathers who've overcome some of the most difficult challenges to be fathers and provide for their families. We've got examples of fathers, for example, who during and after slavery, risked life and limb to make sure their children could be free, sometimes working for years to buy them out of slavery. Fathers who at great risk walked thousands of miles, state to state, through hostile territory to find their children and wives to reunite their families. How do we get from that to this image of the deadbeat dad or responsible fatherhood programs, right? Currently, many Black fathers embody the strength of these ancestral fathers and use it to overcome the impact of injustice, racist policies, economic disadvantage, and other significant barriers to their fatherhood. In the picture above, they're fathers who are living in their cars, bathing at the gym before work, and paying child support, overcoming significant challenges to be in their children's lives. These fathers and many more need you to hear and elevate their voices. So I'm proud to be a part of a group like this where we're making presentations that can make an impact in this space. Thank you very much for your attention and time.
Awesome. Thank you, Sanjata. I am going to ask Mr. Sellers now to come. He is a dynamic professional who's dedicated to empowering students and strengthening communities through education. He is the site coordinator, a site coordinator at Communities in schools of Atlanta and plays a pivotal role in the lives of students by coordinating and facilitating the provision of essential resources and support systems. And so he also serves as a technical work group member of the National African American Child and Family Research Center. And we're happy to hear from him, just his perspective on what's been shared by our researchers and academic partners about community engagement approaches. So I'll turn it over to you, Mr. Sellers.
Oh, thank you, Dr. Rollins. Can everybody hear me?
Yes.
All right, so good afternoon. This has been phenomenal. I probably have not taken this many notes since I was in college. So I've been taking a lot of notes from you all. It's powerful information. And so what I'd like to do is go through and highlight some of the things that have been presented and what I believe are some of the best practices and some of the things that work for community-based engagement. Some of the things that I believe that are powerful that work for the individuals that are in the community. So where I'd like to start is Dr. Rollins, if I'm not mistaken, there was a gentleman on our June 7th meeting that we had. I think his name was Thomas. Is that correct?
Yes, Thomas Cotton.
Yes, so Thomas. So one of the things I remember from June 7th was Thomas spoke a couple times and he was very emphatic about that we need to remember that all this research and all these practices, they are attached to real people's lives. So that's something that I wanted to highlight and emphasis because we do the research, we get the data, we're moving and grooving through what we're going through, but all this is attached to real people's lives. So I thought that was something that was powerful and impactful that he mentioned. And so therefore I'll go through, and I know we have a time constraint, but I highlighted some things that I thought were powerful and that were great that you all mentioned through your presentations. I'll start with one of the mentions was seeking diverse viewpoints for equity. And so I think that's important to have a diverse population to get the equity, to get the viewpoints and the equity that we need out of all that we do and more in particular, all that you all do on the research side. One of the other things was being transparent about all the research process, being truly open and transparent about the research process. The other piece was, I believe Dr. Harris said that you need to be honest about what you don't know. And I think that's so important and pivotal about being honest about what you or we don't know and what we know. Because sometimes, yes, you're the expertise, yes, you're doing the research, but we are not and cannot be the authority on all situations. So I thought that was important. The other piece that I heard was that to build, it is necessary to build naturally beneficial engagements rather than transactional engagements. And I thought that was also powerful because what happens is children or adults, people don't know, or they don't necessarily care to know what you're doing unless they know how much you care and how intentional you are about the process. So I thought that was powerful. The other piece that I noted was perspective of community and voice in their value. And so as we engaging folks and as we're going through this process to really, really care about their voice and their value. One of the things I mentioned to one of the folks at our meeting on June 7th, that I said to them, I said, oftentimes people are in survival mode. So because people are in survival mode, oftentimes things that we believe are important become low on the totem pole to them because they're simply in survival mode. They're trying to survive. They're trying to pay rent. They're trying to keep the lights on. They're trying to feed their children. They're just trying to get month to month to the next month, or oftentimes the next week. So I think that's important to mention. Ms. Miller, I'm sorry, is it Dr. Miller? I saw on your report the list of cities that were listed, one being Cleveland, Ohio. I'm from Cleveland, Ohio. And so in Cleveland, the disparity and the poverty is overwhelming in the city of Cleveland, as it is in, I'm sure, most cities and a lot of cities. but I mean, that just hit a, you know, that just hit something for me because I'm from there, born and raised in Cleveland, Ohio. I don't know if you know about the particular neighborhoods in Cleveland, Ohio. I grew up in the Cleveland. I grew up in the Harvard Kinsman area, which is one of the, you know, unfortunately, one of the most dangerous, one of the most impoverished neighborhoods in the city of Cleveland, which is where I grew up. And so that just hit a note with me there. The other thing I heard, which was powerful to me, which I think is very important to the people that we serve, is what is your personal why? What is your personal why? Why are you invested in this? And you know, why do you think this is so important and so necessary for these communities that also that I heard someone also speak of that we live in, and we all live in sometimes inclusive communities where we have an influx of people who are not so educated or not so well endowed with money, but we're all part of the same community. So I think that's very, very important. I think the other piece that I heard I want to speak on very quickly is that biases are real. And so we must address these biases that we have. And those biases must be addressed. And we have to be honest about those biases that we come preconditioned with those biases. The gentleman that last spoke about Black fathers and their significance in their roles. And so I'll tell you all a quick story. Myself, I'm a father of four. I have a 20-year-old, an 18-year-old, and two 8-year-old twins. And oftentimes within the school system, I have been the individual who is most present at the school simply because of my wife's schedule. I have enrolled the children in school, so my number and information has been placed in my children's file as the main contact, but by default, they always call my wife every single time. And so to the point where my wife even asked them, do you have my husband's contact information? Do you have his information? And they said, yes. And she said, well, let me ask you a question. Why is it that you did not call my husband? And so I think that's powerful. And by default, the system or society is used to dealing with mothers and mothers only, as if, to your point, you know, Black folks are not one monolithic group, not one monolithic style, not one monolithic family set. There are a lot of us who have families in place. Not an ideal family, because I don't know what that means. I don't know what an ideal family is, but nevertheless, there's a family in place. And so therefore, why did you not call their father? So I you know, but I could go on. I could go on and on about that part, but I'll get off of that. And so I think this was so powerful. I think this group, this technical work group, is so powerful. I think it's so necessary. I think it's something that needs, well, it will continue. I'm not gonna say it needs to continue, but it will continue. And I think it's powerful. And so these are just my brief snippets of what you all discussed. And I know we got to go. And I just want to simply end with this. James Baldwin simply said, we can disagree and still love each other unless your disagreement is rooted in my oppression and my denial of humanity and right to exist. And so I will leave you all with that. Thank you very much.
Thank you, Mr. Sellers. Awesome job. Thank you all for presenting and sharing your expertise in community engagement with us and with our audience. There was one question in the chat. I think Dr. Miller did answer for Dr. McGregor, but if any of you also want to share about any policy implications of the research that you're doing to center equity in your work with historically marginalized communities, feel free to share there. Nope. Just Dr. Miller.
So I think that so we're at a place in the Reframe Project where findings are coming out, and we have to go through a process before we can come out with all of the recommendations and so on. But I will say that there are a lot of findings that relate to how policies can be influenced. Or, I've spent some time focusing on fatherhood, but this project really is about elevating all Black voices, right? And fatherhood is a space where there's a lot of work that's needed, as many of you know, and policy change is a part of that. Just even looking at the term responsible fatherhood that's written into the funding, I'll share some feedback, which is that a lot of the programs and clients found that to be very offensive. And so we're looking forward to elevating those voices to share how the terminology should be different. And also, we've heard that programs have stopped using the term responsible. They may use it with funders, for example, but not with their clients. So that's one thing that they have done in order to be more respectful of who they serve, not assuming that they're not responsible. And so how we look at terms that we might normally just think we all have a general understanding of what that term is, like resilience, like community, Dr. Green Harris. Listening and elevating those lived experience allow us to redefine those terms, resilience, community, and have those terms be and more empowering because we've listened. So I think we're looking forward to, with this work, elevating policy change from that perspective.
Thank you, Sanjana. Ms. Green Harris, you were going to say something too?
Yeah, I think I'll just add to that, and I just want to thank my colleagues on this platform. Everybody has just been so phenomenal, and everyone has said something that has just made me take notes and be like, oh my God, this is awesome. So, but I do want to say, as far as policies and practices, I can give a quick, I know my work is very different in this specific work, but what we have been able to do is influence policies and practices and research. For instance, we do blood draws, and one of our community advisory boards were saying, why are we drawing 8 vials of blood when I'm a study participant and I can't even see it? I don't understand where all this is going. And it really made the investigators go back and say, okay, let's think about it. And quite frankly, they reduced the number of blood draws. So now that was an internal thing, but it actually affected how the research is being done now, and thinking about, do we really need to be doing X, Y, and Z? Do we need to be thinking, how are we making sure that we're putting the participants' well-being first before the research well-being? And I think so those are things that are happening, and they happen at small increments on our, let's say, institution level. But as the institution begins to share that on their platforms, when they're doing public and national and international presentations about these changes, it then affects how other folks are doing the work. And I also think, when I think about just some of the policy changes that have happened around how we actually engage community, language is huge. What we say, what we don't say. We have pictures of nooses in our research study, and they were like, oh, this can't happen anymore. And so it's different things like that have really impacted our work as an institution, which I think for this institution is really interesting and really helpful.
Awesome job, everyone. Definitely thank you to our attendees as well who decided to stick it through with us. I did put in the chat a link for you all to complete our survey, just to let us know your feedback on the webinar. And, again, to help us continue to improve what we offer for you all. Let me go back. I'm supposed to be at there you go. So thank you all so much for your time, and we will meet you again next month. We have another webinar, so make sure you register for that. And we will put this recording on our website, on YouTube, as well as our NAACFRC.org website. And if you have any questions or want to follow up with any of the speakers, please feel free to reach out to us. Thank you all again so much for your time and your expertise. Have a good one.
Thank you so much.
Thank you.
Thank you, Dr. Rollins. Thank you,
Thank you, Dr.
everybody.
Rollins.
Hi, thanks, Dr.
Bye.
Rollins. Thanks, all.